and welcome to Docplexus News. On 26 September, President Ramnath Kovind signed an ordinance on a committee who will be in charge of duties of MCI until the Parliament passes the legislation on the National Commission Bill. A panel of 7 members will be in charge until the MCI is replaced by the proposed National Medical Commission. The Board of Governors will be chaired by the Niti Aayog member, Dr. Vinod Paul, the former professor at the All India Institute of Medical Sciences, Delhi. He will be assisted by Dr. Sanjay Srivastava, the former Deputy Director General, Directorate General of Health Services, Ministry of Health and Family Welfare. The other members of the board are Dr. Randeep Guleria, Dr. Jagat Ram, Professor B.N. Gangadhar, Professor Nikhil Tandon, Dr. S. Venkatesh and Dr. Balram Bhargava. Both Dr. S. Venkatesh and Dr. Balram Bhargava will be ex officio members. The Bombay High Court has permitted abortion in a 30-week pregnant woman who already has a child with Down syndrome. The woman had appealed for abortion when her unborn child was detected with multiple neurological abnormalities during examination. Taking into consideration the couple's request and financial status, the court allowed the woman to terminate her pregnancy. A team from the Cincinnati Children's Hospital in Ohio have successfully generated human esophageal organoids using human pluripotent stem cells. The esophageal organoids have been grown in about 2 months. This organoid can be a new model for studying birth defects and diseases concerning esophagus. The US FDA has approved MOXETUMOMAB PASUDOTOX injection for intravenous use for the treatment of adult patients with relapsed or refractory hairy cell leukemia. It would be administered to those who have received at least 2 prior systemic therapies, including treatment with a purine nucleoside analog. Approval was given as 30% of patients in the trial achieved complete recovery and the overall drug response rate was about 75%. Blood banks in Mumbai recently received the updated format from the National Blood Transfusion Council pertaining to the selection of blood donors. The guidelines suggested that gay and bisexual men, transgenders and female sex workers can never donate blood as they have a higher risk of spreading HIV and hepatitis B and C. The center has approved a new postgraduate program in public health with the creation of a dedicated cadre of professionals and researchers. The University Grant Commission has asked higher education institutions to consider introducing Masters in Public Health in their list of full-time postgraduate courses. The program aims to develop analytical and assessment skills in students for collecting and interpreting information in areas of policy planning, communication, and advocacy. The Secretary of Women and Child Development stated that the National Technical Board on Nutrition has approved guidelines proposed by the Ministry for Severe Acute Malnutrition. Top Nutrition Panel of India has recommended that severely malnourished children should be fed with freshly cooked food prepared from locally available cereals, pulses, and vegetables. These were the latest happenings in the medical field brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!